Alright, so after giving you a brief history about the development of the different references that we used in arriving at a diagnostic impression, let's talk about how we should understand each diagnosable mental health condition coming from the DSM-5. These are a set of things that we need to study, be familiar with, or even master. All right? So let's dig into these diagnostic criteria. As mentioned from the previous video, the presentation of the different mental health disorders in the DSM-5 is divided into 4 sections. We have the section 1, which talks about the basics of the manual, how we can actually use it, and some cautionary statements for forensic use. Then we have the section 2. That's where the diagnostic criteria, codes, and other textual information are actually located for every diagnosable mental health condition. For the third section, that's where the emerging measures and models are discussed. Then the fourth section is known as the appendix, where the different supporting attachments can be found. Okay? Pero magfo-focus tayo in this video dun sa section 2. Ano nga ba ang pwede nating makita for each of the different groups of these mental health condition and for each specific mental health problems? Okay? So, let's start with the different disorders. So, they are actually classified according to groups, according to their classifications, taxonomy, and nosology. Okay, they are following a set of guidelines on how they can group together certain diagnosable mental health conditions. Okay, so for each of these diagnosable mental health condition, of course, the first thing that we would notice is the label or the names that are actually assigned for such presentation. How terms are, for example, updated. Some of the things that we might encounter would be the use of functional neurological disorder, okay, which is previously known as conversion disorder. Okay, that's also where we can see the other disorders that were recently updated, no? So, like for example, yung multiple personality disorders, makikita natin yon from the previous versions. But now, it is actually known as dissociative identity disorder. Okay? So, yun yung labels, yung mismong pangalan ng disorder. And then, after that, immediately are the set of criterias. A set of observations and behaviors that must be exhibited by the person that could tell us that indeed this person is manifesting this psychological disorder. Some other qualifiers are also specified in there, such as the number of criteria that must be satisfied, the duration, all right, that must be satisfied by the client and the presenting symptom. No, some other qualifiers such as how it produces significantly high form of distress and impairment across the different areas of functioning. Okay, yung iba dapat hindi better explained by other psychological disorders or cannot be attributed to other possible explanations such as drug intoxication, other medical health problems that are found to be related with the development of almost the same symptoms. Okay? So we have the label and the set of criteria. After that, some of these orders actually has their own subtypes or specifiers. It could also talk with the severity. Yung iba meron diyang label na with in partial remission or in full remission. For example, sa bipolar disorder, meron din siyang additional specifiers such as with rapid cycling, with mixed features, okay? So we need to recognize those specifiers as well because we can use that to arrive at a more accurate set of diagnostic impression. Like for example, for ADHD, meron siyang 3 specific types. Merong with mixed presentation, merong with predominantly inattentive, meron din namang predominantly hyperactive. Okay? So we need to learn how to specify those things by using the specifiers or by specifying the subtype of that specific diagnosable mental health condition. Alright? So aside from those things that are listed immediately right after the label, better if we could also read about the diagnostic features. That is actually a presented in a textual form where some examples or more definitions are actually provided for those students or even for clinicians who are already practicing. Kita pala yung coffee cup ko. Dami pang spills. All right. Going back, aside from the diagnostic features, I also mentioned about the secondary features or associated features. Okay, these are just a set of manifestations that are not basically dominant, for example, or dominantly observed from each of these patients, but may accompany those diagnostic features that you previously read on the set of criteria and the other textual informations. You can also study about the prevalence, incidence, possible development and course, the other risk and prognostic factors, what could help them, and what can perpetuate such conditions. You can also study about some culture-related use of understanding such diagnosable mental health condition, the existing suicide risk, some of the expected functional consequences, and another important section is the differential diagnosis. This is actually where you can differentiate closely related set of diagnosable mental health condition. Like for example, how can we differentiate bipolar disorder with psychotic features from schizoaffective disorder? How can we differentiate bipolar disorder from borderline personality disorder? How can we differentiate major depressive disorder from adjustment disorder? How can we differentiate this disorder to other closely related disorders? Okay, that is specified in the differential diagnostic or differential diagnosis part. Okay, we can also understand about some of the most common comorbidities of these disorders. So sometimes, and if ever the presenting symptoms are severe enough to cause significant impairment, aside from the other actual presentations, there are mental health disorders that can be diagnosed concurrently, no, with the other concerns. Like for example, depressive disorder and then an anxiety disorder. Pwede rin namang meron pang personality disorder. Again, it depends on how you could differentiate the existence between the two, how one can actually serve as an explanation to the presentation of the other one. But again, if those symptoms are severe enough and if they did satisfy the criteria for another disorder, then that could warrant a separate diagnosis. Most of the information about these can be found in that comorbidity section. You can also understand where these diagnosable mental health conditions can be coming from by studying their etiological explanations. Okay? So, by going through those sections of the DSM-5, we could have a better understanding how we can give an accurate and valid diagnostic impression coming from the signs and symptoms we've collected through the comprehensive psychological assessment. So, I hope I was able to explain those things here. Pwedeng medyo mabilis. Alam ko pwede nyo namang i-replay or medyo bagalan, no, yung pag-play ng video. But I hope I was able to share some ideas on how you could easily understand the DSM-5 and how we can arrive at a diagnostic impression. Thank you so much for listening, guys. Again, this is Lordy, ang tito mong psychologist.